Okay, welcome everyone. My name is Kian Wong. I'm the head of the enrollments and marketing at Postural Orthodontics and the host for today's webinar, Introduction to Postural Orthodontics, how my brother's widgets, we affectionately call the Wong widget appliances, and why parents are investing and learning about early intervention, the importance of early intervention. 145 consecutively treated cases reveals the 7 steps to straighter teeth, beautiful faces, and better airways. We have a very special guest on today too, actually. We have Professor John New, the creator of Orthodontics, who is joining us all the way from London. We've had some technical issues, so you won't be able to see him, but we'll hear his voice, so apologies in advance for that. And we also have Mr. Enrico Di Giovanni, the founder of A Point Dental Lab, who co-created the appliances with Dr. Simon Wong. For the last 12, 13 years they've known each other. They've been working and perfecting these appliances, which you'll be learning all about in the next hour. So moving on. Quick thank you shout out to Dentarum Australia and A Point Dental Lab. And this is also at the end of the presentation, we'll be briefly mentioning, we're very excited to have our first ever 2-day introduction to postural orthodontics live in Sydney, Australia, at the end of July 29th and 30th, which is a weekend, at the Dental Education Centre, very close to the airport, at Dr. Derek Mahoney's newly renovated Dental Education Centre. It will be also live streamed. If you can't fly down to beautiful sunny Sydney, we do have a live stream option, so you can still join in, and as well as get instant access to last year's 2-day recording, so you're well prepared and it's more of a refresher. So that's coming up end of this presentation. Learn a bit more about that and some specials we have. Firstly, quick introduction to Dr. Simon Wong. He's the founder of Postural Orthodontics and a leading expert in facial growth guidance and early intervention. He's held the position of visiting professor, co-director of the Orthotropics module at the University of Valencia, Department of Orthodontics, and is a fellow of the International Academy of Dental Facial Aesthetics. The past 13 plus years as the principal of the Clinic Natural Smile Centre based in Melbourne. He's been focused full-time on the correction of early childhood craniofacial development issues, a devoted practitioner for the early correction of malocclusion. He's a published author with journal and textbook articles on sleep disorder breathing, with his most recent article, The Jaw Epidemic, Recognition, Origins, Cures, and Prevention, published in Bioscience 2020. His current clinical research at the Orthodontic Department of the University of Alberta, and most recently at Texas A&M, under the supervision of Dr. Peter Bushang, will hopefully provide the pathway for the future of orthodontics to be focused on cures and prevention for all oral facial development issues for our children. So please welcome Dr. Simon Wong. Simon, you there?
Yes. Hi. Thank you.
All right. So I'm going to pass it over to you so you can introduce folks. I've been over the last few years compiling my brother's, over 150 cases. So we've been submitting it for research, but, we'll have I put together a very short 6-minute slide presentation. We won't show all 150, but a good few of them. And I'm going to pass it over to you, Simon, to bring it up. And then after the 6 minutes, you'll do your short half-an-hour presentation or so. All right, thanks. Over and out.
Thank you. So tonight we are going to go on a journey, an introduction to early intervention. We're going to explore some of the differences between postural orthodontics and other forms of early intervention. We will investigate the possibility of mandibular expansion and how we can create the mechanics behind this process. We'll look into the possibility of making early intervention a normal part of practice without focusing on the marketing and advertising. And we want to give you the opportunity to join us at the end of July this year in Sydney, where we can talk in depth about my postural orthodontics. And we are very fortunate to have a guest, Professor John Mew, the creator of Orthotropics and the leader of early intervention in the growth and development of facial beauty in our children. So my journey and the origins of postural orthodontics really came to light when I met John Mew about 15 years ago. And his book, The Cause and Cure of Malocclusion, changed my entire perspective on orthodontics. Fortunately, John has made online access of some of his chapters within this book to be available free. And I would encourage you to look at orthotropics.com in the shop and test drive this wonderful manuscript. John has a price of £150 for his book, but if you journey with us through the rest of this evening, we'll help you with a discount so that you can enjoy this very important and significant work. The years before COVID were full of travel for me, and I was very fortunate to have the compliment of a friend and colleague, Enrico, who created with me the program that we will be sharing with you for the rest of this evening, and if you join us in July in Sydney. Over the years, I was very fortunate to have spent time being taught and mentored by very significant founders of the early intervention that is seen across many parts of the world today. I created a simple book for children to grasp the concepts that John taught me on oral posture, and Sandra Khan and myself created this instruction manual to help spread John Mew's work. About 10 years ago, I started to share some of this knowledge and created a program that helps clarify the role of posture and malocclusion. And, over the years, I've been very fortunate to share this knowledge with pediatric dentists around the world, orthodontists around the world. And I hope to share it with the general dental practitioners today, who really are the front line and the first point of contact for many of the children who need early intervention. One of the questions that I wanted to answer for people who were interested in this concept that I created, postural orthodontics, is how is it different to other forms of early intervention? One thing that I wanted to highlight was postural orthodontics works within the system of the standard of care of orthodontics. We use existing mechanics, proven products that have a history of not decades, but multiple decades. And we modified these to be useful in today's practice. We created appliances that could reopen spaces when early tooth loss created collapsing arches. We created appliances that could effectively expand the maxilla. And one of the things that I'll talk about today is the creation of an appliance that can effectively create mandibular arch expansion. We've been fortunate that a number of universities, the University of Valencia, University of Alberta, University of Texas, have been interested in the work that I have been undertaking in my practice. And we found that when we compared the treatment modalities between accepted functional appliances, we gained significant improvements relatively to the changes in sagittal dimension that were only barely possible, barely changed with traditional functional appliances. We were able to reduce vertical dimensions at a much greater rate when compared to functional appliances. The study at University of Alberta, the study at Texas A&M, they are opening the doorway for posture as a treatment modality to be made available and to be scrutinized so that we can have the opportunity to have peer review of the techniques that have been successful within our private practices. One of the leaders of the understanding of true mandibular rotation and growth mechanisms in children into their adulthood has been Professor Peter Bouchang. He has been the director at Texas A&M and a big part of Baylor College of Dentistry. What we have been very fortunate is his interest in orthotropics has provided an avenue of sharing John's work with the faculties of orthodontic research, hopefully around the world. The preliminary findings from our study have been very positive, and we hope to be able to share this in the near future. So tonight's focus is on mandibular expansion. And one of the points that I do want to help people understand is that there is a difference between the terminology mandibular expansion and mandibular arch expansion. We cannot forget the suture in the mandible fuses very, very early in a child's life. But we do have to remember that we can influence alveolar bone. And we have to remember that alveolar bone in an adult is not the same as alveolar bone in a teenager and is not the same as an alveolar bone in a child. I want to be able to help you understand how we can create enormous change in the arch form of young children. I want you to understand that mandibular arch development is possible. And I want you to remember that mandibular arch development in dental alveolar bone of a 7-year-old encompasses 3/4 of the height of the mandible. We have to remember, where there are teeth, we can influence. And I can remind you with this X-ray that there are teeth in almost every segment of the mandible of a 7-year-old. And where there are teeth, there is influence in orthodontic postural appliances. These are not new concepts. O'Grady in 2006, in the AJODO, undertook a long-term evaluation of the mandibular shorts appliance and the acrylic splint expander in early mixed dentition patients. Removable mandibular expansion Schwartz significantly more favorable results than in RME-only protocols. When we have greater increases in the transverse width of the mandible arch and the mandibular arch perimeter in the long term, following uprighting of the mandibular posterior teeth buccally, allows for an amount of maxillary expansion that was clinically effective. See, we can all expand the maxilla, but we forget the limit of our expansion of the maxilla is set by the mandibular arch form. Imagine how wide you can make the maxilla if you could create a wider mandibular arch form. McNamara in 2009, in the seminars in orthodontics, presented a 4-decade perspective on orthodontic and orthopedic expansion in the transverse dimensions. After 4 decades of research carried out at the University of Michigan, treatment effects produced by expansion in the late mixed and early permanent dentition and the early mixed dentition includes the lower Schwartz appliance. Expansion of the transverse dimensions has many indications. Constricted maxilla, as manifested by a narrow transpalatal width. Eliminate posterior crossbites, anterior crossbites, in conjunction with a facial mask, and improving tooth size, arch size discrepancies. Rapid maxillary expansion alone, or in combination with a removable lower Schwartz appliance, prove clinically significant increases in the available arch width, improvements in smile aesthetics, the creation of space to aid in the eruption of impacted canines or incisors, and enlarging the nasal airway. We have been exposed to the concept of mandibular arch dimensions for half a century. It's proven, it's effective, and it creates a much more favorable potential for maxillary expansion. One of the reasons why we no longer focus on this is because we've lumped all early intervention into the same category without really grasping that fixed appliance therapy in teenagers is hindered when we don't use early intervention opportunities. We need to highlight what is possible when we use knowledge and smart mechanics. We have the potential in a young child to create enormous change, permanent change, change that is extensive in the vertical dimensions of the entire mandible. We consistently, when working with younger children, when using the appropriate appliances, create space, create beautiful arch forms that give the potential for matching the maxilla potential expansion and overcoming the limitations that we've always had, with the misinformed view that mandibular arch expansion is the same as mandibular expansion. And because we cannot expand the mandible, we can't change the mandibular arch form. We're all taught the rule. After the lower canines have erupted, we are set in our transverse dimensions. There is no point expanding further because the mandible will not take it and you'll push the teeth out of the bone. And I'm not here to disagree with that statement. But we have to remember the mandibular canines, the permanent canines, erupt between 10 and 11 years of age. If we operate at 4, 5, 6, 7, 8, 9, 10, before those canines erupt, do we not have the potential, if we understand physiology and anatomy, to change what is possible in creating beautiful mandibular arch forms that are stable because they set in pubertal bone hardening in a beautiful form? We have a tool and knowledge to use that tool. And I hope that you will let us share this with you in the upcoming program that we've created called Postural Orthodontics. I've been fortunate that I've had the opportunity to use techniques that have consistently provided beautiful outcomes. And I have been fortunate to have mentors help me over the hurdles. I hope now to pass that forward and to share with you in our 2-day introduction to postural orthodontics the shortcuts, the tips, the secrets of how to avoid all the pitfalls that I encountered in my journey over the last decade and a half. In Sydney this year, on Saturday and Sunday, July the 29th and 30th, we will be meeting at Derek Mahoney's Dental Education Center. And I hope that you will join us so that I can share with you how you might impact the community around you with early intervention postural orthodontics. I want to share with you the evidence behind what I've been doing. I want to share with you the knowledge of the special guests that have agreed to pass on their knowledge. Professor John Mew, the creator of Orthotropics. Mr. Perry Burston, a Melbourne-based ear, nose, and throat surgeon. Dr. Susan Shea, specialist pediatric dentist based in Sydney. And Enrico Di Giovanni, my friend and colleague, founder of A Point Dental Lab, who has helped make my journey possible by creating these magnificent appliances that are literally reshaping the children under my care. We have knowledge that needs to be verified. We want to achieve results that work, but we want to be able to explain it to our community, our profession, so that we stay within the boundaries of evidence-based dentistry. I hope that what we do in early intervention is recognized, because we'll be able to remind people that it is robustly evidence-based and that everything we do is logical, sensible, and within the standard of care of orthodontics. Kian?
All right. All right. Thanks. All right. Sure. Yeah, I'll take over here. All right. Before we get to Q&A time and introduce Professor John Mew, I'll just quickly go over some of the different options regarding the two-day event, if I may, just a couple of minutes, if that's okay. We have three categories of tickets. We have a standard ticket, just come to the event in Sydney, and after the event, we'll email you the presentation slides. Pricing is currently $1097 USD, or you can get three payments. Option down below, $397, and we're still in this kind of special phase for another month or so, and it'll jump a couple hundred US. The end pricing I think is $1397 or something like that. And we have a premium ticket, which is additional $200, so it's $1297 at the moment. But it comes with the recordings of the event, and importantly, it also comes with instant access. A lot of people have been inquiring about different courses that we have, and we say, just get the premium ticket, because not only can you attend in person in Sydney, but you get instant access to the recordings of last year's event. Last year, we only do this once a year. And last year, we only did it on Zoom. We did a 2-day intensive. It was still kind of COVID, it was still relaxed. They were still relaxing the restrictions with COVID and everything in Australia about a year ago. But now, things are close to normal again. So we're very fortunate to hold a live event in Sydney. And so the premium ticket comes with the recordings, not only from last year, so you get instant access, you get started straight away, and attend as well in person. All right, so that's $1297, extra $200. And finally, if you can't make it to Sydney, which is a long haul for a lot of you guys joining from Europe and the US who are joining in today, there's a virtual ticket, which also comes with instant access to the recordings from last year. So you can get the training straight away, and you can also attend live, and there's quite a few hours of Q&A throughout the 2 days. All right, so that's $100 less. Now, yeah, so we house all our recordings. You get 2 years access, which is more than enough to go through There's about 20 hours from last year, plus another 8 or 9 hours of bonus Q&A calls that we held after the event. So it's really good, a good option if you can't physically get to Sydney. Now, we do have a special. You guys have joined and made an effort to join tonight. There was 270 registrants and about half have joined. So it's great to have you guys on tonight. But if you enroll by tomorrow, so you get a full 24 hours to think about it and go to the website, straighttoothnaturally.com. We're just offering a, token $100 discount off current website prices, which are already special at the moment before we go to, early bird regular pricing. You just need to email me. We don't have any checkout page or anything fancy. We thought we'd just give a $100 discount as a way for you to buy John's book, right? John's book is quite chunky and 150 pounds, about 200 US, 180 US. But, if you join tonight, effectively you get a $100 discount and you can use that to purchase John's news book. If you do nothing else tonight, go get John's book. So you can just email me directly. I'll be manning the emails over the next day. info@straighttoothnaturally.com, subject $100, 100 off. All right, just a small discount for those who'd like to join us in the next day and get access to the recordings. If you get a premium ticket or the live stream. So that's the 1097 would be $997 US for a standard ticket. The premium ticket would be just, roughly 1200, and the live stream ticket would be just under 1100. All right. So info@straighttoothnaturally.com. Let me just type that in I'll type that into the, info@straighttoothnaturally. All right. So just send us a quick email if you'd like. And you've still got 24 hours to think about it, and we'll send you an invoice, and then you can make that decision after you check out our website thoroughly and see if it can fit in with your schedule. End of July. Now, we do have a full 30-day money-back guarantee for the live stream ticket because you get instant access to the recordings. So you can literally watch the whole thing in 30 days and decide whether it's something you can implement. If you don't, email us back, get full money-back guarantee. If you buy a live ticket, in-person ticket, then come. Attend both days. You have to attend both days. And you still think it's not for you for whatever reason, we'll issue you a full refund. All right. So now we do have a lot of two-day grads joining us today who've joined in the last year or two or three since we started this in 2020. We do have a brand new service we want to share with everyone that we've decided to do in conjunction with Enrico. So if you want Dr. Simon Wong to design your first few appliances before you get the hang of it, now relatively simple to design, but obviously there's a learning curve. And if you want Simon to personally do it for you as you order an appliance through Enrico, we are now offering that. So you simply, once again, just email me at info@straighttoothnaturally. This is a brand new service. So we never offered this in the last 3 years. And, the training, we gave the training, and we were getting some feedback. It would be good. Some people wanted this. So we decided to make the arrangements to make this happen. So you just email us, same email, info@straighttoothnaturally, Wong Design, excuse the pun, subject Wong Design, and I'll send you over the next few days. We're still finalizing the format of how this is going to happen. We're having a discussion with Enrico tomorrow night. So give us a day or two to respond, but we'll give you the exact instructions so Simon will be able to do the design for you. Some of you who have also completed the two-day grad, if you want Simon to supervise your cases, we have a mentoring program. This is so for everyone's FYI, there's not just the two-day intro, obviously. There is an advanced program and there's a mentoring program. And if you want to learn about it after you finish the 2 days, some of you, as mentioned, have finished the 2 day or bought it last year in July and are now interested in the mentoring program. We're opening up some spots at the moment. So it's by application. You get to speak to Simon for free, have a chat with him one-on-one, 30-minute call with Simon before you decide whether it's a good fit or not. All right. So go to straighttoothnaturally.com/application. So for those who are interested in the mentoring program, the advanced program, where Simon will personally supervise your cases. You can apply on the link we just shared. I think that's about it. Just wanted to have a bit of a public service announcement, as mentioned, so to speak, some of the new things that we're developing. So before, let's introduce our esteemed guest, Professor John Mew from the UK. Let me, if I may unmute John. Still mute. There we go. Unfortunately, we had some technical problems. My bad. We couldn't get the video working. But John, are you there? Can you hear us?
I just unmuted. Can you hear me?
Loud and clear. Wonderful. Let me just do a quick 1 minute
Right.
introduction. Professor John Mew is the creator of Orthodontics, graduated in dentistry at the University College London, and then trained in orthodontic surgery. Seeking alternatives to facial surgery, he moved to the specialty of orthodontics in 1965. Since then, he has been pioneering and developing non-surgical methods of correcting unattractive vertical growth in children's faces using orthotropics, which he coined to encourage horizontal growth. A retired clinician, I beg your pardon. His principal research interests are the etiology of malocclusion and the guidance of facial growth. He was honored with life membership of the British Dental Association in 1999. Currently 94 years young, it is truly our great honor to have him speak tonight and our event in July. Bless you, John. How are you?
Hello, John.
All right, welcome, John. Simon, yeah, join in and have a chat with John.
What I was hoping to do is pick your brain on a couple of.
Can I butt in, Simon? To
Yes.
remind you, I'm quite deaf. You'll have to speak loudly. And if
Yes.
possible, I'd like to see your face on full screen as I lip read. That would be better. Thank you.
Okay, wonderful. Am I on full screen at the moment?
Fine.
Okay, so I wanted to pick your brain on a couple of questions because one of the things that I've learned in my journey with you is that as a budding early interventionist, our focus is almost entirely on transverse expansion, and particularly the maxilla. And one of the things that drew me to you was your concept that you could easily expand a maxilla and a mandible 10 millimeters or more. And it seemed like a completely foreign concept to me. And I asked you to be very clear with explaining the significance of this. And the thing that was most interesting for me was you said, Simon, don't get lost in transverse expansion. That's not the key to good growth, you said. It's important, but you said horizontal growth driven by posture and not mechanics like transverse expansion is the single most important thing that I can teach you. Would you elaborate a little bit on why so few of us understand the importance of posture in forward growth, horizontal, sagittal forward growth?
Yes, Simon. I don't remember saying that, but I still believe it as much now as I did then. It is horizontal growth which matters. Lateral growth is going to be very unstable unless the tongue corrects. But most people don't realize that the average human face is set back, their mid-face, that is, by about an inch. That is the average. Now, an inch is a huge amount. That is why you look around you, and most people have flat cheeks and big noses. Just ask yourself why. The whole of the middle section of the face is set back about an inch. It varies, but very few people are less than 10, 15 millimeters too far back. I do know that my emphasis recently has been on achieving 20 to 30 millimeters of forward growth. Now, you would know as well as I do that conventional orthodontics is quite unable to gain any forward growth. They gain a little with forward pull equipment of one sort or another, but otherwise, perhaps practically all fixed appliance treatment retracts the face, often only 1 or 2 millimeters, occasionally a little bit more, and not infrequently a lot more, and that really damages faces.
Yes, I think that we're so used to seeing faces that cannot house the entire dentition, that we have learned to accept that it's normal to have your wisdom teeth removed, that it's normal for our children to need to have braces. And we have confused normal with ideal, and common with acceptability. We don't have the tools available to encourage forward growth. So we've kind of fixated on the only thing that we have control over, which seems to be a little bit of transverse development of the maxilla. But even that's hindered by the fact that we can't actually develop the mandible in any degree. So despite all the wonderful expansion that people do in the maxilla in the early years, it's all lost by the time the child hits puberty, because there's nothing to hold it. Your concept of tongue posture, lip posture, dental posture was something that was at odds with what we're taught at dental school. In dental school, the training focuses us on accepting freeway space as a normal. You know, that it is correct to have your teeth apart 4 to 8 millimeters, that your tongue rests comfortably on the floor of your mouth and your lips are lightly touching. Your concept of the tropic premise, where the lips should be in contact, the teeth should be in light or near contact, and the tongue should be fully on the premaxilla, the hard palate, and the soft palate simultaneously with the floor of the mouth for between 4 and 8 hours a day, was something that I had no concept of. Many people understand the significance of lip seal, but few understand why teeth need to be in light contact. And few people understand that the tongue not only has to contact the premaxilla, but it has to contact the full hard palate and the soft palate. But equally, that time is an important factor. How come you think, why is it that people don't understand the concept of posture, but they focus entirely on function?
An interesting point, Simon. The word you mentioned several times was normal. Normal is a very dangerous word. It is equivalent with average. Well, on average, our face is about an inch. But that is all right, normal for us, but very abnormal for our primitive ancestors, whose faces were, as I say, an inch further forward. The freeway space has created a lot of problems, largely because of the use of that word normal. Someone, I think it was just after the last World War, did research on the average posture of humans and found that there was a freeway space of 2 to 3, maybe 4 millimeters. So they then pronounced that that was normal. Yes, it is normal, but it's not correct. And that is the big difference. Everybody who leaves their teeth apart, the teeth naturally erupt. You may have heard of my tooth eruption mechanism. Every single individual tooth has its own eruption mechanism. They naturally erupt. If they come into contact with something, they'll stop erupting. If they are long-term in contact with something, they will intrude. It's fascinating to know that when you wake up in the morning, your face is longer because your teeth have erupted. But after each meal, your face is shorter because the teeth intrude. This is a constant activity which is necessary for all mammals. Every mammal's life depends on having perfect occlusion. If the teeth don't meet correctly, they will die. It doesn't apply to us. We live on soft food, which we can drink as easily as chew. But the essential problem, I think, is the use of that word natural.
We have stopped living a natural life for thousands of years. We have, I mean, the fact that you're in the United Kingdom and I'm in Australia and everyone else listening is dotted throughout the world tells us we're not living a natural life anymore. We live in a world that we have created with technology. And it's a wonderful world, but we don't want to throw the baby out with the bathwater. There's no reason why we can't keep a modern lifestyle, understand the significance of an earlier period within the evolution of mankind, and readopt the important components that kept our bodies physically more powerful. One thing that I noticed growing up over the last 50 years is that the focus of parents on their children's posture has gone from incredibly important part of culture to being non-existent. My grandparents, they were born in the 1800s, and they had my parents late, but they passed on the culture of a time when life was physically more demanding. And my parents passed on those concepts about posture to us. And because we were fortunate to have grandparents that lived a long time and we spent time with them, they spent time to share that historical, age-old knowledge that we need to stand upright. We need to sit upright. We can't drag our heels. We don't want to be looking at the ground. We want to have eyes towards the horizon. We want to have good core muscles in our belly and torso. And we need to keep our mouth shut and chew our food without talking, breathe through our nose so that we don't choke. And we need to digest this usually not particularly nutritious meal and savor it. Today, I see children with little bags of mushed juice, slurries and smoothies, and they slouch like rag dolls over their phones. They drag their heels. They look like they have spinal disease. And almost all of them watch TV with their mouth open. And I've noticed that the parents, who are usually in their early 30s, are doing the same. So they don't even notice that their children are behaving in a way that provides no stability to their skeletal growth. Now, you're of an era where you saw hardship, where if you were not physically robust, you wouldn't survive. It must be frustrating for you to see people today with such poor posture.
You're right, Simon. I brought my children up with that very simple philosophy. Hardship is good for you. You mentioned lifestyle, and you said that we should be able to overcome it or maybe bypass it. That, I think, is the problem. People do not appreciate how different our lifestyle is now from what it was. When a mother comes to me and says, John, how could I bring up my children so that they don't have these problems? I say to them, it's very simple. Sell your house and buy a cave, preferably in the top of a mountain. Don't eat anything unless you've killed it before or picked it, and never cook it. Not many people actually follow that advice, but that is a measure of the difference of our lifestyle now. In my belief, 3 aspects of lifestyle are the cause of almost all malnutrition. 1, living indoors. That is one which just does not occur to people. But all allergies come from allergens, and every bedroom is absolutely full of floating dust. And I have not the slightest doubt that is the main cause of all allergies, all the asthmas and problems that so many youngsters have these days. It is unnatural, but nobody wants to live out of doors. There is a modern solution there, Simon. Modern heat exchangers can also filter the air. So if you set them on a high enough setting, they will remove the dust and yet not lose much temperature. And I think before long, that is going to be standard for certainly every bedroom, but I would think probably for every house. It'll take a long time because, of course, the power consumption will be enormous. But in our drift from our, how shall I say, a civilized society, we've also forgotten about hard or soft food. Now, our ancestors ate really hard food. So hard was the food that the cusps of their teeth had worn flat within 2.5 years of eruption. That's not long. By the time they were 60, the first molars were usually worn down to gum level. That is what we see in primitive skulls. And yet, the only time you see worn cusps now are in bruxers, and they're considered pathological. I'm sure both you and your brother have all your cusps probably in full hunt, but that's because you've lived on slops all your life, as indeed I have. and I couldn't possibly chew the food that they used to then. The final cause of malocclusion from lifestyle is the lack of breastfeeding. People think that is normal. They say, well, we can feed with a bottle, why worry? But what I think very, very few people realize is that the way you learn to swallow correctly is by firmly pressing on the breast to get the milk out. Most mothers think that suckling involves sucking. It does not. People should never swallow by sucking, and yet over 90% of people in this world do just that. They suck when they swallow. That collapses the maxilla, and which is why 90% of us have narrow maxillae. The maxilla should be 44 millimeters or maybe more. The average maxillary width in British subjects is 33.5 millimeters. There is no way you can find room for 32 teeth in an arch which is that narrow.
Agreed, definitely. This is very clearly shown through research. So, John, there's a lot of our guests today who are participating in, they have a lot of questions, and just wondered if it would be okay if we had them ask you some of those questions and perhaps get some answers. But Kian, before we start, can you bring up John's event slide?
Yes. Oh, we have an announcement on behalf of John. Perhaps, John, you can talk about this as well. If you'd like to meet John in person in London, you can do so in September 22nd, 23rd. John, unfortunately, won't be able to fly down to Sydney end of July. It's a bit of a trip, but you can meet him in London. John, you want to tell us a bit about this event?
That is kind of you to put up. And yes, I hope to have a good turnout because I see so many people who do orthotropics but achieve only 5, maybe 10 millimeters of forward growth. I don't see many people achieving more than 15 millimeters, and yet you should routinely, I mean with almost every child, be able to achieve 20 or 30 millimeters, and you will finish up with a good-looking face, like the ones on the picture there, and you will not have sleep apnea, you will not have ear, nose, and throat problems, you will not have TMD problems, you will not have malocclusion, you most certainly will not need surgery to correct your jaw, and added to all that, you'll be good looking as well. So I should recommend you to come.
Can't beat that. All right, terrific. Thanks for sharing this with everyone. So hopefully you can meet John in person. 22nd, 23rd of September, go to johnmuorthotropics.co.uk. Simon, there's a few questions coming, or one question from Daniel I'd like to read out. Is mandibular arch expansion possible during teenage years by using a stage 3 bioblock appliance, training the patient to keep the mouth shut? Simon or John, both of you, I guess, should address this.
Yes, if you use a stage 3 appliance, which is the single most important apparatus created for orthodontics by John Muir. But it has a very different mechanism. When you use a screw to turn acrylic to apply pressure on the dental alveolar bone, that's a mechanism that works in pre-pubertal children. But once you hit puberty, the bone hardens and you can't continue to use mechanics. The stage 3 hard locks, which John created, works only when the posture supports the light pressure that adding acrylic to create light pressure points along the teeth. It's not something that can be expected to work with mechanics. It is only something that works when the posture is correct, because you have the tongue creating the correct pressure, and we're just aiding it with the use of the stage 3 appliance to remind the teen and the child how they should be with their posture.
I think I've heard enough. You can listen to this if you want to. I think I'm going to go and relax in the other room.
Okay.
All right, one, John. Thank you so much.
I think they've probably muted us now.
Oh no, we still can hear you, John, if you can hear us. No? Can you hear us, John?
Yeah.
No? Let's all give our thanks, share our thanks, extend our thanks to John for joining us. John, can you hear us? I think he's
Well, thank you so much for...
Thanks, John. Yeah, I think he's headed off, but we'll still be here to answer any other questions from everyone else. Okay, thank you, John. If you can still hear us. We're sorry, we've had some technical problems, but all right, Simon's still here. Well, let's open up the questions. So if anyone has any other technical questions related to what you saw
do you want to just go back to the normal screen now?
Yeah, sure.
And then if you can read out the questions, then I can answer them.
Yes. Yeah, so just let us know what your questions are. Okay, just so far it's just Daniel. If there are any other questions, feel free to raise your hand. Oh, cool.
Do you want to go to the normal screen so that they can see us?
Okay, sorry, I mean like this.
Yeah. So will you read out the questions?
Yeah, I can read out the questions. So there's RT Jane. I think I've unmuted you. So I think you raised your hand. Do you want to turn on your microphone and ask your question directly to Simon, or type it in? Are you there, RT?
Maybe just read it out.
You haven't submitted. You raised your hand, so I'm assuming you have a question. You could type it in, or you can. I've unmuted you, so you can talk if you'd like. If that was a mistake, that's not a problem.
Can you hear me?
Oh, yes, Artie, please go ahead.
Hi. So, hi, Simon. Obviously, I'm
Hello.
based in the UK, and I just wanted to understand how easy is it to get these appliances made in the UK, with the different labs here, and especially because I did your 2-day course, I'm still working through that. But how easy is it for, an orthodontist to dive into these kind of appliances based on the experiences? Because I've tried the other ones. I went to Dr. Truitt's course. I did a lot of appliances that he suggested, like three-way Schwartz and some other appliances that he was recommending. They were a little complicated for the mandibular arch. It involved a button and some wires, whereas yours look very good, and especially the Wong, and Dr. Muse, who I greatly admire. But I just wondered, is it only specific labs here? And if we wanted to start doing these cases from an early age, because I also recommend from around 6-year-olds for our children at our practice, even earlier if we can, with some myofunctional appliances. But how easy is it to get it here in the UK? The design.
Well, there's a couple of ways that we can help you with that.
Mm-hmm.
Obviously, Enrico can help if you are prepared to send STL files.
Yeah.
It can be shipped over. But we've also, Enrico has also trained technicians in Poland, and he's trained technicians in Lithuania. So obviously it's a little bit easier for you to ship things from
Shipping
Europe.
there, yeah. So
Um,
nothing in the UK, or is Dr. Muse, like, does he have something here?
Yeah, and then Mike Mew has their lab as well. So
And would
obviously,
you get your appliance there as well? Like they are trained to do the Wong widget as well, like for the lower arm?
no, they tend to use their own appliances.
Yeah,
but
because I think I took my daughter to him and they
Yeah,
did show some bio blocks and stuff, but
Yeah.
uh, I
but
mean,
my
I'm
specific appliances at the moment, we only have people
in
in Poland
Lithuania,
and
Poland, or
Lithuania
in Australia.
who are able to provide that, or we can ship them out here from Australia.
Actually, Enrico's here. Look, Enrico,
Yeah.
what's the turnaround time,
Yeah.
ship to the UK?
Oh,
We do some.
It's 12 working days.
12 working days. Okay. And shipping cost obviously would be just added on because we can send the STL files. That's not a problem.
Yeah, I do it for 12, 13 different countries. So it's
Okay.
all in Europe.
That's good to know.
As long as I get the STL file,
Yeah.
and let Simon do the design for you if you want, right?
Yeah. Yeah.
Which is very, very good to do.
Yeah.
And you'll get them and you won't have any issues.
And how easy is it to, like, as with the lower expansion cases or upper or lower, which I was doing? I mean, the patient is just turning the key, obviously, at the recommended rate. Is there much adjustments and stuff for these ones? Like, do we need to do quite?
Look, there's always technical sides of it, whether it's
Yeah.
braces, whether it's
Yeah.
Invisalign, whether it's even if it's a my brace, right? You have to,
Yeah, all of
you have to
them.
pull the scissors out and trim and do adjustments. So, that's some of the things that we help you with in the advanced program and in the mentorship program.
Okay.
Many people can kind of work their way through the process if they've, if you've used Schwartz appliances before, for example,
Yeah.
then you won't have any issues
This is a
because
lot.
they're the same issues. But if you want assistance, then we have
More of a
we
training.
have programs that provide whatever level of assistance that you want. If you just want theory, there's theory only.
Yeah,
If
basically mainly like just the theory, like how it's different to a Schwartz and like just the literature on that. And
yeah,
basically,
for sure. So
like
we
any
have,
new thing and the
Yeah,
recommended turning rate and how
yeah,
everything.
that's
can be
all
different.
in that's all covered in the
That's all in there. Yeah. Postural,
yeah.
I'm just still working through the course. It's quite a lot of information.
Yes, it's not,
Life takes over. Yeah, but it's those things are good. But I just thought I'll ask you that how easy is it to get these appliances? Because they look really good. Yep.
Wonderful.
All right. Thank you.
So
Thank you, Aarti.
Artie, just
Wonderful.
email us.
Yeah, sure.
info@straightteethnaturally.com and mention the appliances, and we'll connect you with Enrico and talk about if you want Simon to get involved with the design, what's that?
Yeah. Maybe sending few cases before we. Yeah, that'll be great. Thank you.
Thanks, Artie. All right,
Thank you.
appreciate it. We've got a bunch of other questions, so let's power through these. If I may read them out, just go through the order of as they came in. We have. It's best if you can type your questions in the Q&A box and not in the general chat box. But let me just quickly go through. Eric Davies, welcome, Eric. Good to hear from you. What exact screw are you using for the lower Wong widget and 10 rate? Says Eric.
That's Eric, you've done the 2-day introduction. It's actually in the handout manual.
Okay, if you have trouble finding that, just email us and we'll dig it up for you, Eric. Part of
We use fluorescent skeletal sagittal screws, and we use Dentarum skeletal sagittal screws.
Very simple.
Yeah, so that it's all in the handouts.
in the download section. So Eric, if you're not sure where that is, just send us an email and we'll give you some guidance on that. We have very comprehensive practice templates, downloads, etc. as part of the 2-day intro. Sometimes people forget to download them, and that's why we just got to remind everyone it is all there. All right. The question from Lydia Lozanova. Excuse my pronunciation. Thank you, Professor Joe. I'll meet you in September. Fantastic. Vazuki has a question. How do you like to assess the child's level of growth and potential for further growth?
My patient base is between 4 and 9 years of age. So I don't really need to assess the growth because I know they've got half a decade of growth ahead of them. So, like if you pick old patients, then you have to be very particular about evaluating growth. But my program is called early intervention, which means that we're treating before 10. And if you treat before 10, everyone has growth. A lot of it. Enough for you to work with.
Okay, next question. Raman says, are there any trained technicians in the US? They trained, I think Enrico, you haven't trained specifically in the US, so we are still servicing. We're still servicing.
I'm going to answer this question to everyone. You can use any lab you want. I mean, we can't force you to use a lab. But the amount of work that Simon and I have done on this to get the great appliance that's out there that everybody loves, you can train people, but you can't train them in a week, 2 weeks. Okay, you're talking at least a 90-day training program, which is very hard to do for people. So, I mean, I don't want to be the one to say, "Oh my God, send me all your." No, that's not it.
Actually, Enrico, in the past we would say, yeah, you could try to replicate it, but at the end of the day, we want you guys to get the results. We have.
You know what happens? I've told you this and Simon so many times. Yeah, everybody calls me. It's not working. Why did this guy did it like this? This guy. So, and then I end up making an appliance for them. And then, so it's not because we're special. It's we worked very hard at it. And you need to put the wires in a certain mode. The wires have to be a certain shape. The clasps have to be a certain length. There's a lot of little intricate things that you need to do to get it right, or else it's not going to work.
Absolutely.
Back to the Schwartz.
And we've figured out the shipping from all around the world.
Oh, the shipping is easy. DHL, you're getting the thing.
Yeah.
I mean, Simon, we do jobs for that lovely lady in Cambodia, for God's sake.
Exactly.
She doesn't even have a scanner. She sends models to me, and I still get them back in 2.5 weeks because I have to wait for the models to come. The rest of the world, like people from New York, all the Midwest send me work and stuff.
Exactly.
I get them in 5 minutes.
Yeah,
So,
we live in a world today where every one of us on this call is from a different corner of the world.
Yeah.
So with that technology means that you want something from Melbourne, Australia, sent to you in
easy.
Arkansas, it's there.
Doing
Yeah.
Just try out Enrico, right? And if you can replicate it with your local lab, fantastic.
By all means. By all means.
Keep on ordering from, Enrico. The Aussie dollar has dropped a lot. It's cheap in the US. Anyway, let's move on to the next question.
Next question.
Okay, Vazuki has another question. What analysis are good to evaluate discrepancy?
We encourage you to use whatever analysis that you want because they will tell you what the skeletal classification is, and that's basically all you need. You need to know the vertical dimensions, the y-axis, FMA, and you want to know what your skeletal relationship is relative to the cranial base. So you just need to know, are they developing vertically? Are they developing with retrusion? You use the normal orthodontic analysis. Just use whatever you like. The message is always the same when it comes to vertical growth dimensions, and vertical is the most important component for you to use as a flag of warning, so to speak. Right? Horizontal growers are fairly easy to treat. It's the vertical growers that create all the dramas, and all the analysis are very similar in their defining of the vertical dimension, and you just focus on whether it's outside of the norm, and if it is, then just beware. Okay, next question.
Next question. Christoph Bottini. Hi, what's your experience of expanding arches with aligners in the pre-teens years? Thank you.
0. Never done an aligner in a preteen. Okay, next.
Okay, sorry. All right, Heidi. other than the GoPEX book, what other myofunctional therapy do you include in your program?
I don't use anything other than what we have in GoPEX book. Although in the advanced program, I will talk to you about GoFX, which is the finishing exercises that we teach for tongue control. So
Right.
the exercises that I have are half dozen or so exercises, and that's it. That's all I use. I'm not here to eliminate dysfunction. When you are focused on resolving dysfunction, there are literally hundreds of exercises that you need to be able to solve dysfunction. What I'm focusing on is to improve posture. And to improve posture, literally one handful of exercises is all you need. Okay, next.
Okay. Implemented consistently. All right, next question for Adnan Anwar. We've just discussed mandibular growth in children for mandibular growth in adults. What possible devices are there? There are, of course, surgical options.
Yeah, surgery is the only thing that you can use predictably within the standard of care for adults if you want mandibular skeletal change.
Okay, just so you know, the Postural Orthodontics program, I get asked it all the time. It's only for children. Simon only starts treating children as young as 3 and max around 10-ish, right? Case by case, but ideally before 8. 8 is too late, as they kind of say. So if it's teenagers and blah, 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 it's not our area. It's not where the evidence and literature has shown. So that's why we stay clear of anything that's not evidence-based. There's people being sued in America for doing expansion work on adults, as you probably heard about recently, right? That's not where we go, right? Anyway, Raman, are there any trained labs in the US? Okay, no, we've already answered that question. One more from, Vivian Tran, V Tran. Yes, hi, Simon. What is the advantage of using removable appliances over a 2x4 braces early intervention expansion with coils taught by EODO, which is Dr. Derek Mahoney's course? P.S. I do love your Wong stage 1.
Well, it depends if you want to move teeth or you want to change the dimension of the alveolar bone. So if you want to affect skeletal change, then you need a lot of coverage and pressure on the bone. When you put braces on teeth, or you're moving our teeth.
All right, terrific. Thanks for that question, Vivian. And
I think last question.
I think that was the last question. Oh, there's another call. It's getting a bit late in 10:30 in Australia. I'm in New York, so you can email me. It's early morning here, 8:30. If you have questions regarding the course, thank you, AJ, for wanting to join our program. I'm getting some emails. So just email us if you want the $100 off by tonight. We'll give you 24 hours to think about it, and you can decide if you want to take advantage of this $100 discount. Once again, submit your last questions as I type in the info. Just email us at info@straightteethnaturally.com and either have 100 off, or if you want to learn about, if you finish the 2-day course, you can get Dr. Simon Wong to design your first few appliances and have Enrico make them and ship them to you wherever you are around the world. Let's just put Wong widget in the subject header. Thank you, Chang. Good to see you again. We've had
Ken, Enrico and I will sign off. But,
okay.
Why don't you go through the offers and explain people how they might.
Okay. All right. Sure. All right. So if everyone wants to stay behind, I'll answer any questions regarding the event. Enrico, thank you for joining us, buddy. Simon,
Thank you so much.
good night.
See you.
Thanks, everyone. John,
Thank you to everyone. Thank you so much.
thanks, everyone. So we've still got 60 odd people here. So it means that there's some questions that administrative questions in relation to the event. Otherwise, thank you for joining us tonight. If that's all you want to stay on for, we will send the recordings to everyone if you want to revisit. So do email us if you want the recordings. other than that, I will stay on for a few more minutes to answer any questions in relation to the offers, the specials that we have, et cetera, et cetera. So let me just clarify what is on, so to speak, on offer. If I just bring up my screen, or just type in the questions, or just drop off so I know that no one is more interested. If you're still on, it means that you still have questions, hopefully, that I can answer in relation to the event. So yes, if you want to check out our event, it's just go to straightteethnaturally.com/live. The special pricing, $100 off. We can also do a 3-month payment plan as well if you want. If you want to spread it over 3 months or even 5, if you want that, just to send us an email. So in-person ticket, $997 in Sydney. Extra $200, you get the recordings from the event and last year, and importantly, you get all the practice templates as well. Now, if you can't make it to Sydney, joining via live stream, it is $100 off the premium, $197. So you can watch from the comfort of your home. You don't have to fly to Sydney. You get instant access to the recordings from last year, which means you can start the training straight away. Some people get it done in a few weeks because it's about 2 days worth of training, 8 hours a day, plus some bonus Q&A. But you can, as soon as you finish the training, you can start ordering appliances from Enrico. If you want, you can get Dr. Simon Wong to design them for you if you feel you need that support. We do have people, I can't even make it live stream. Well, we do actually have just recordings, actually. You can just buy the recordings if you can't attend at all in the live stream. In the past, we used to sell the recordings for, what is it, $997, I think. I can't remember. Register now. The recordings from last year was $997. So we can drop an extra $100 off as well for that. So if you only want the recordings of instant access to the recordings from last year as well as this year, we'll throw it in. It's $897. So that we never mentioned that option before. But for those of you who've stayed beyond and you just want the recordings, it's send us an email, say you just want the recordings. If you want to attend live, the benefit of attending live, it forces you to sit down, block off your calendar for 2 days. I know the completion rates of recordings, right? And it's less than 50%. So people buy the recordings, they don't go through it all, right? You know what happens. You try to sit in front of a computer for 8 hours straight when it's just, without being live and not being able to ask questions, and it's difficult. So we do encourage everyone to attend the live stream. Worst case, if you really can't and you just want the recordings, we can offer it for $897. All right. So you can email us if you want just the recordings. Vazuki says, thank you, Simon. Great to see you in Enrico after 9 years. Okay, that's great. So you saw him in Sydney. Yeah, maybe you guys can reconnect again in July. All right. So the 100 off will apply to just the recordings as well. If you want, this is for, just to clarify, if you've never ordered, if you've never completed the 2-day introduction, then we won't be offering that special design service, and only until you've done the 2-day course, which makes sense, right? If you don't learn how to utilize the methodologies, then ordering appliances doesn't make so much sense. We have a 30-day satisfaction guarantee, as mentioned. And we have an advanced program. If you have completed the 2-day, if you'd like to learn more about it, you can jump on a call with Simon for free. It's no cost. It's a 30-minute one-on-one to see if it's the right fit for you. So we have just theory. You can complete the advanced theory, 25 hours of core training, phase 1, 2, and then you can, go through phase 3 recordings and jump on the phase 4 mentoring, where Simon, you can just try it out for 3 months. It's normally a 1-year mentoring program, but we want to give people a chance to try that out. You can submit 2 cases every 2 weeks, x-rays, photos, SEP analysis, etc. And Simon will personally write back to you a written critique. You got to fill out the form and provide the PowerPoint presentation in a way that follows the methodology that Simon teaches in phase 1. So you have good records, and he can give you supervision, and that's available as well. All right, so yeah, any other questions? I think a few questions have come through. Okay, unfortunately, they've already gone. Simon, anonymous attendee says, aligners for arch expansion, what do you think about them? Are the outcomes more predictable? I'm not a dentist. My brother's a dentist, so I can't answer that question. What about affecting? All right, so unfortunately, Dr. Simon Wong has retired from the presentation, and it's quite late over there in Melbourne. So apologize for, if you do email us if you've got a couple of questions, but I think that's about it. We still have 45 people on. So if you have questions, do reach out. Otherwise, I'll wrap up. Unless you guys are on, but not really on, as it happens. So I'll say good night to Anne, Anna, Daniel, David, Kevin, Carl, Lisa. Lisa's joined from Arizona. Welcome. Anyone else on? Just so you know, everyone signed off. John Mew looks like he's on, but in reality, he has signed off along with my brother Simon. Good night from Spain. Thank you, Nadia. If you have any questions related to the specials, send us an email at info@straightteethnaturally.com. Get $100 off. If you can't attend live at all, live stream or in person, our special for the recordings is just $897 for the recordings of last year, and we'll give you the recordings of this year's as well. Good night from Melbourne. Lydia. All right, hopefully you can join us in Sydney. Still have 40 people on. I'll keep on saying goodnight until everyone just drops off, unless there's any really final questions. So any final questions? Going once. Oh, got a chat. What is this? Yes, of course. You have a question. Oh, you will be joining. Oh, fantastic. All right, looking forward to getting your email. We'll give you a special invoice with the $100 discount. Sure, had a question. Okay, wonderful. So I've got a few emails coming through with the special request. So good night, Susan. Hopefully meet you in Sydney. I'm in New York. I've got 2 young ones, and my mother's with us. So unfortunately, I won't be able to fly down for the weekend, but I will be manning everything from New York, and I have to look after the Zoom attendees. There's more attendees who are buying live stream tickets at the moment than in person for different obvious reasons. But I will, well, you'll see a video of me on a big screen if you attend on Sydney. It'll be larger, not in life. I haven't visited Sydney in too long. I left Melbourne 18 years ago. Time flies. So I'm based in New York. So unfortunately, I won't be able to meet you in person, but I'll still be there in spirit and in virtual terms. Good night, and anyway, hopefully you'll meet my brother and Enrico and Susan is a pediatrician based in Sydney who's been part of the mentoring program for 2 years, and she'll share her experiences, how Simon has transformed her children's lives with the treatment over those years. All right, so any final questions? Otherwise, good night, good morning, wherever you are. Hope to see you guys in Sydney. Cheers.